Bismillahirrahmanirrahim. Today we will discuss about another second line drug antibiotic commonly used in neonatal intensive care unit, that is vancomycin. Group is peptidoglycan inhibition of cell wall synthesis. Basically, it is a bactericidal drug. If we can see over here, we have different brand names like Winject or Venbect. Different formulations. IV injections come in 500 mg or 1 gram, 2 gram or 5 gram. Oral form formulation is 25 mg per 1 ml, or in capsule form 125 mg or 250 mg. But in oral form we use this vancomycin only for Clostridium difficile colitis. And if we talk about pre-mixed form, it is also present in the market, like 500 mg in 100 ml of in dextrose, then 750 mg of vancomycin in 150 ml of dextrose, and 1000 mg of vancomycin in 200 ml of dextrose. And if we talk about its covering, mostly the vancomycin covers gram-positive pathogens, MRSA like methicillin-resistant Staph aureus or methicillin-sensitive Staph aureus, and enterocoli and pneumococci, enterococci, and Clostridium difficile. And if we talk about here, that vancomycin is useful for most gram-positive pathogens, including Staphylococci, Enterococci, Clostridia, Pneumococci. Along with that, it is useful for burns, for MRSA, for MSSA, for uncomplicated skin soft tissue infections, septic arthritis, anthrax, peritoneal dialysis associated peritonitis, community acquired septicemia, blind therapy in endocarditis, in catheter-related bloodstream infections, lymphadenitis, acute mastoiditis, neonatal meningitis, orbital cellulitis, and periorbital cellulitis, which is preceptiform, erysipelas, non-immunized children for H. influenza and Streptococcus pneumonia, spinal fissure infection and chronic sinusitis, infected ventricular peritoneal shunt, and orthopedic surgery, and antibiotic prophylaxis for open fractures and closed fractures. And it is also present in the market in topical and intrathoracic form for localized infections. And I have mentioned about this dosage, and we talk about this. It is not only autotoxic or nephrotoxic, but it also causes hypokalemia, abdominal pain, nausea with capsules, and neutropenia and thrombocytopenia in combination with the clefron like ceftazidime in severe meningitis, and it is also in combination with linezolid. All the features covered by the vancomycin. If we talk about the dosage form, in units less than 2 kg, it is 15 mg per kg per day in BD or TDS, like in 8 hourly or 12 hourly. And if the age of the neonate is more than 2 kg, we should give 45 mg per kg per day in 3 divided doses in TDS. In children, we may give this vancomycin 45 to 60 mg per kg per day in TDS. And the maximum dosage for this vancomycin per day is 2 gram. It is written in the all this information gathered by Herit Lane and BNF books. And if we talk about, in your screen, I will show you a chart of this interval of this vancomycin. Like we have three charts. First chart we have PMA, post-menstrual age. It means post gestational age plus postnatal age in weeks. In second column we are having postnatal age in days, and third column we have interval in hours. If PMA, post-menstrual age, in weeks, if it is less than 29 weeks, and all this table you can see on your screens. And after this dosage and these indications, if we talk about the side effects, it is autotoxic. It may cause stress like drug reaction with eosinophilia and systemic symptoms. It also causes it is nephrotoxic, because 70 to 80% of this clearance of this vancomycin through the kidneys, nephrotoxic. And don't forget about the red man syndrome. If we give this vancomycin too rapidly, it may cause red man syndrome, increased production of histamine, and all this information we see. We should give this vancomycin 60 to 120 minutes. In this duration, we should give very slowly. And apart from that, oral vancomycin, it is category B, and IV vancomycin category C. We know we have category A, B, C, D. By FDA, in category A, all those drugs which are having zero side effects, or you can say no toxic to the humans, in which we are having folic acid or levothyroxine. In category B, we are having oral vancomycin or paracetamol, acetaminophen. In category C, the drugs which are having side effects like IV, vancomycin or this fluoroquinolone. Amoxicillin comes in category B. In category D, like all those drugs, if we do not have any alternative, we should give these drugs like you may give these ACE inhibitors or tetracycline. And in category S, which is contraindicated in pregnancy, like thalidomide or sodium valproate acid or lithium or misoprostol, all these are category X. So that was about vancomycin. Thank you so much for your time.